Good afternoon, everyone. I'm sure the tea is really, keeping you away from exciting session of synergizing healthcare proficiencies through interdisciplinary education. So we have with us expert panel on the dais, and of course we have expertise within the audience. There are healthcare professionals who are not only experts in their particular fields, but they are very experienced. So we were given the opportunity to synergize with FICCI for developing a white paper on healthcare proficiencies through interdisciplinary education. We thank our chair of the FICCI Health Services Committee, Dr. Harsh Mahajan. Is sir there? And thank you, sir. Dr. Sanjeev Singh, he is the co-chair of the committee, and Dr. Anupam Sibal. They have given wonderful inputs for the development of this paper. At this point of time, we would also like to thank other members of the FICCI team, like Honorary Brigadier Dr. Lal, who is the chair of the FICCI Swasth Bharat. Here, we would also like to acknowledge the development of, the FICCI paper. Yeah, FICCI paper by other members. Do we have the presentation on? Okay, so I would also, at this point of time, would like to thank Dr. Narottam Puri. We are really missing him today. And lots of inputs were given by Mr. Gautam Khanna, who is the past chair of FICCI Health Services Committee. Dr. Muzaffar Ahmad, former member of the National Disaster Management Authority, Government of India. And Ms. Thankam Gomez. She is the founder, CEO of Signia Healthcare Academy. We would also like to thank our very own provost, Dr. Rajiv Verodikar. He is the provost of the Faculty of Medical and Health Sciences at Symbiosis International University, and our team that helped us actually draw out a lot of data and suggestions for developing the paper, like the director of the Symbiosis College of Nursing at Symbiosis, then Dr. Zoshi, Dr. Anuradha Vaidya, she is the director of the Symbiosis School of Biomedical Sciences, and Dr. Parag Rishi Patak, he is the director of the health sector, health skills, Symbiosis Health Skills Department. So on this note, I would also like our revered members sitting on the dais. This is the paper. You can all get access to the paper because it is available on the FICCI site. So I'll just join the panelists for the further comments. So now that we are a little settled, I would like to continue the session. For optimum healthcare delivery to be very effective, we need to have an organization where the pyramid, which talks about the healthcare, that is the doctors at the top of the pyramid, the nursing fraternity at the middle of the pyramid, and the base, which is allied health professions. We need to really realign our thinking. We need to reimagine the components of this healthcare delivery system, and we need to rejuvenate about, thinking about how we could really express ways of optimizing healthcare delivery. Now you must be all aware that the doctors, though they are not really very adequate, but the doctors, nurses, and the midwives, they are only 44.5 doctors per 10,000 population in India, which is woefully low. During this 2024, at the current state, we have about 20.6 as the data of the healthcare professionals in India per 10,000 population. Though it is better than 2005, where we just had about 13.6, the problem that we today have is the disparity between the urban and the rural divide. There is also disparity regarding the geographical locations. Now, if you see in Punjab, there are increased number of or high number of allied health professionals, but if you go to Jharkhand, it is just 0.3 of the population, which is woefully low. So this is really a problem, major problem in the Indian context. Now, to look at the universal healthcare coverage, what do we really need to do? We also know that the Sustainability Development Goal 3 is health and wellness. Are we really going to, just talk about getting more?
Hello. Please keep, there's a session on. Have some mercy on us. Thank you.
So to go ahead, we are really dependent on the medical, infrastructure, of course, with the health professionals infrastructure. Recently, JP Nadda ji has announced that there will be increase in the number of medical institutes to the tune of 766 from 2023 to 24, where it was just 706. Now, we do understand that there is a lot of passion where, the entire medical fraternity and the government is trying to increase the number of seats. But are we really ready for it? Do we have quality teachers? Do we have even a fraction of the infrastructure? And we are still thinking of an 8% increase. There is a lot more to do in medical education. There was a wonderful session in the afternoon regarding medical education and what are the problems there. So we will not really delve into medical education so much. But we would also talk here about nursing education. We have with us a very well-known figure in the nursing fraternity, Dr. Dilip Kumar. He is the president of the Indian Nursing Council. And regarding Dr. Dilip Kumar sir, I have been very closely associated, and when we established the nursing college at Symbiosis, we really were sitting and working on how to improve the facilities. At that point of time, INC really did not have a very well-defined curriculum, though there were a lot of engagements with different nursing professionals, not only in India but all over the world. There is a lot of disparity in understanding the nursing education in India as compared to the world, where in the world the status of the nurses is absolutely at a high pedestal. Whereas in India, again, they are at the middle of the pyramid. That's what I had just mentioned. So Dr. Dilip Kumar, he has really worked during the COVID-19, and it was really thanks to the nursing fraternity who have really come together and saved so many lives. So Dr. Dilip Kumar sir, question to you is that what are the different trends in the nursing education in 2024 as compared to a few years back, and how are we really going to take it ahead from a regulator's point of view and from the Indian Nursing Council point of view?
Good evening to all of you. First of all, I would like to thank the organizers for giving me the opportunity to share my thoughts. The nursing education, I think we have gone with a quantification of expansion from the 2020s, but quality is a concern. So though we have established now about 1,900 auxiliary nurse midwifery training institutions all over India, and also about 3,035 diploma in general nursing midwifery institutions, and about 2023 BSc nursing colleges, about 750 postgraduate institutions. One of the very important program with a lot of deliberation, we have established nurse practitioner critical care. I happened to work in the Ministry of Health as a nursing advisor. I could not succeed in getting the policy approval for the nurse practitioner critical care while I was a nursing advisor. And after retirement, I am working as the President Indian Nursing Council. In 2016, I think I always remember Devi Shetty. I think I requested him to make an advocacy with the then health minister, now the present health minister Nadaji was there at that time. We collected the data in Bangalore with the intensivist, how they look the nurse practitioner critical care program. All intensivists, at least in the corporate hospital, in the private sector in the Bangalore, they gave a very good recommendation to start the nurse practitioner critical care program. So when we went to the ministry after preparing the syllabus, when Dr. Devi Shetty met the health minister, he pleaded for in India there is a need to have the nurse practitioner program. So then they were asking, why can't we start? So then we prepared the nurse practitioner with the input of the CMC Vellore, the experts, and we took the syllabus to the Ministry of Health. The Ministry of Health asked me one question. You as a regulator, you have a power to prescribe the syllabus for all category of the nursing professional. Why have you come to Ministry of Health? So I have to tell literally, if we have to roll out in the healthcare delivery system in India, until unless the Ministry of Health TAPA is not there, we will not be able to implement. And this is the word. And I think this is the one syllabus I am, at least in my almost 43 years of working in the nursing sector, and this went to the health secretary. Under the leadership of the health secretary, a meeting was called with a lot of deliberation, even with the input of the Director General of Health Services. The nurse practitioner curriculum was approved, and about 63 institutions are running this nurse practitioner program. And only during the COVID, how MGM Medical College in Mumbai and Krishna Institute of Karad intensivist telephonically told to me, during the COVID, these are the nurse practitioner who was able to manage the ICU in their respective centers. Similar response we are getting. Now the Ministry of Health has realized that. Now they have asked us to prepare 10 nurse practitioner program. I think we have already about 8 nurse practitioner program we have laid out. I think developed countries, and like in USA, the highest qualification a nurse can think of is Doctor of Nursing Practice, especially the PhD for the educational professionals. For the clinical people, they have a Doctor of Nursing Practice. So we were able to sign an MOU with the University of Houston, and now only last about 2 weeks back, we launched the DNP program in MGM College, Medical College in Mumbai, and Krishna Institute of Karad. So I think now ultimately what is the issue we are facing is, we can create any number of professionals. When the posts are not created, there are no takers. So that is the one challenge which we are facing with the Ministry of Health. And now I think ultimately, at least with a lot of deliberation, you might have heard that in the Parliament has approved the new legislation, the National Nursing and Midwifery Commission. In that National Nursing and Midwifery Commission, in the existing Indian Nursing Council Act, we don't have a component of scope of practice. In all the other developed countries, any regulation will have a scope of practice is there in their regulation. But in India, we don't have that scope of practice in the Act. So we have ensured that in the new Nursing and Midwifery Commission, we have included the scope of practice into the existing bill. I think that will address a lot of the issues and challenges our nurses working in the clinical setting, they will be able to solve that. And also the legal empowerment will be given to those tasks and the protocols which our nurses and midwives are doing. That is one change. And again, another important critical point which you are facing in the nursing is the state governments, the state nursing councils and the Indian Nursing Council is conflict of interest, in the sense that I think the recognition is given by the State Nursing Council and the Indian Nursing Council is having a power to withdraw the recognition given. So there are a lot of issues which were there. I think that has put us in the Supreme Court a lot of the problems. At least the new Nursing and Midwifery Commission has addressed that. That now the all the regulations, the suitability is given by the National Nursing and Midwifery Commission. That has the power has been shifted from the state to the center. So I think a lot of issues which the nursing sector which is facing has been reflected in the new Nursing and Midwifery Commission. These legal reforms which has been now, even the Ministry of Health in the last budget, they have given a more emphasis of opening the 157 government nursing colleges, co-locating into the medical colleges. When the medical college is there, if they don't have a nursing college, even while I was working as a nursing advisor, All India Institute of Medical Sciences has come up without a nursing college. So we have to tell in the ministry that at that time, first six All India Institute of Medical Science were established. There was no component of the nursing college. Then ultimately, the nursing budget with 150 crore, which we were having, we were able to give to the AIMS. That's how the six AIMS nursing colleges have come up. So while planning itself, which is even at the state level, we consider the nurses are the largest health force in the healthcare delivery system. There are no nursing organization at the state level. I think when we don't have the nursing organization at the state level, it will be difficult to work out with the policymakers. Some doctor is given in charge of the nursing. He is busy with the other works. He may not be able to take care of the nursing human resource, which is very important. We say nursing is a noble profession on May 12th. On May 12th, we always say the World Health Organization in 2020, they declared International Year of the Nurse and Midwife. And they came out with their strategic direction of nursing and midwifery SDNM 2125. It is a very important resolution passed by the World Health Assembly, and which is still one of the 4 themes which has been reflected in that strategic direction of nursing and midwifery. One is investment. It is a music to me, at least working in the nursing sector. The WHO is telling to all the countries, invest the more money to the nursing. So that is and second important theme is creation of the post. Very clearly, because each country have their own nurse-patient ratios are there. But still India is not able to implement the nurse-patient ratio given by the government of India. Many of the states, a simple one answer will come to the government of India. Due to the financial constraint, we are not able to build it. Then how the quality of the patient care in the hospitals can be given. And at the same, the patient outcomes, how is going to be there when you don't have you are not implemented the optimal nurse-patient ratio. The third is the leadership. They have come out with the evidence-based Lord Nigel Crisp. You know, he was one of the NHS secretary in the UK, and he took this decision to the WHO. The nurses can make an impact and outcome in the healthcare delivery system. That's how he came out with that evidence-based strategic direction of nursing and midwifery with the theme of leadership, because if the nurses are trained in the leadership, even in the ward settings, the patient outcomes and impact outcomes are going to be the better. That's an evidence where the nurse-led clinics have made an impact in the different parts of the world. That's how the SDNism is talking. And the last is the service delivery. Working conditions. I think now we are talking, and just now we were talking, there is a lot of overseas countries, people are coming to recruit the nurses here. Because when the working conditions are not properly given to the nursing professional, definitely they will not be able to stay in the, because where the chowkidar is without having a proper education, he is given 15,000 to 20,000 rupees is the salary in a gate. Whereas the nurse with all the professional 4 years of training are given a first month salary, where is the 18,000? That is and again, which is I am talking, highest corporate sectors are paying. That is the one. Whereas if you get into the 2-tier and 3-tier, they are all 7,000 and 8,000. So therefore, I think the Ministry of Health, Supreme Court has given a guideline. Ministry of Health has shared these guidelines to the state government to come out with a regulation that a minimum salary 20,000 to be given. At least even that has not been implemented. So I think one of the problem which we are able to see, like the state like West Bengal. The West Bengal in the directorate, 70 nursing officers are sitting in the directorate who are able to take care of the whole nursing human resource whereas in other states, even the developed states in the India, they don't have one or two nurses at the directorate level. So when the nursing organization itself in the policy is not there, what we can see the outcomes. So I think this new Nursing and Midwifery Commission is going to make some solutions, and definitely there is going to be a working with the state and center will have an impact, and which we have to, but our syllabus, whatever we have prepared, they're like developed countries like Canada. Canada has seen our latest BSc nursing competency based curriculum. They have come to India, and with a regulator from the Brunswick to Indian Nursing Council, we would like to give a dual degree to the Manipal College. That's how we have given 30 supernumerary seats to the Manipal College of Nursing. Those 30 supernumerary students, they have not gone to the Canada. They are only having an online 50 hours of the classes. They have seen our curriculum is so competency-based curriculum with lot of simulation components have been included, and lot of Ministry of Health and protocols have been integrated in the curriculum. By seeing that curriculum itself, they are giving the dual degree to our curriculum. That itself speaks volume of the curriculum we have prepared. But only thing is implementation. The financial, and especially we have only about 10 to 12% in the government sector nursing education. 90% of the nursing education institutions are in the private sector. So therefore, regulation is going to be, when the state nursing councils are going to be regulated, I think we have to have a lot of enforcement and lot of planning at the state level. That's why this new Nursing and Midwifery Commission has made a change in that decision making. We have to see and make an impact. But at the same time, I think our syllabus and quality is a concern. So we have Indian Nursing Council has come out with a state-of-the-art simulation center in the Gurugram we have established, and that we have trained about 1,600. Because now simulation means getting an equipment with a investment, you can bring it. Until unless if you don't train the faculty how to integrate the simulation as a method of education, it's not going to be successful. So that's where we are addressing that. About 1,600 faculty has been trained. And again, live register. When the parliament asks the question, how many nurses are there in India? We don't say how many nurses are there. We simply say that 1947 to date, how many nurses have been trained, we say, because we know that we don't have a live register. So therefore, Indian Nursing Council has come out with a nursing registration tracking system, NRTS. So we have a 1 million nurses, latest email ID with the latest photographs, 1 million nurses we have a data, and that data also takes care of the specialization, whether they are the pediatric nurse, whether it's a OBG nurse, all the details are there. But still we require a support of the State Nursing Council. Once we freeze this, then definitely a collector, by putting the district name, you will be able to get how many nurses are there in that district with specialization. So the once you have a live register, that will facilitate for a effective nursing manpower planning at the state level and also at the national level. So this 1.1 million, now the Ministry of Health has also asked the other regulator bodies also to start this live register. I think until unless we don't have a data, I think we are not going to have a effective manpower planning. So I think the issues and challenges in nursing, I think the latest implementation of the strategic direction of nursing and midwifery, the WHO resolution, and also the implementation of the new Nursing and Midwifery Commission will have an impact and outcome for the nursing in future in India.
It's a very passionate talk by Dr. Dilip Kumar. And there is, I mean, the way he mentioned, though we have the capabilities of dual degree, development of curricula, as well as, the funding is a issue for developing state-of-the-art nursing institutes in India. We will further go on to talking about the allied health professions, the public health professionals, the healthcare management, and we have with us Mr. Ashish Jain. He is the CEO of the Health Sector Skill Council, and he's done a lot of work in getting skilling and upskilling and reskilling of these allied healthcare professionals. So, sir, we would like to know about the current status of the allied health professionals in in India. I mean, we are very aware that even in 2012, we started, we were invited, and I was one of the members of the task force of the development of the allied health sciences, curricular regulation, and from the Ministry of Health and Family, where we were over 300, experts coming into the picture. And it was only in 2021 when the National Commission for Allied Health and Professions Act had come into vogue. And in fact, Supreme Court has really encouraged the central government, the state government, and even the union territories to start the implementation process from 15th of October. I'm sure there is hope. I've just got the news that Trump has become the 47th president of USA, and of course there's going to be a lot of changes. You see the stocks are improving, so there's always a hope in the allied health sector, because there is going to be a lot of funding coming in. So all yours, sir.
Thank you, Dr. Smita. Good evening, everyone. I think it's a difficult session because being the last session probably, and it's the end of the 2 days conference, but nevertheless, I think we have the best people in the room. I think we can't expect best of the experts while we have Dr. Harsh Mahajan, Dr. Sanjay Singh, Dr. Lal sitting in this room with us. So I think it makes good for us and the other people who I don't know as it by name. So it's good for us. I think probably that will give us more concentrated effort in seeing what we wanted to intend to do. Coming back to allied health, as an allied health, probably there's a lot of requirement which has happened, and we had an allied health bill which has come in and which is enacted now. Although I can't be the official spokesman for that bill, but still I'll try and cover on behalf of that. It's already enacted. I think the interim commission is already constituted, so they're going to start work. Several states have already constituted their state commissions also on the allied health, so it will start working on. So anyway, it'll take a little while. But having said this, I would say I would like to draw a different, opportunity, like you mentioned about that, in US just Mr. Trump has become the president. See, what I see is all these issues will always remain with us. And I think Dr. Dilip Kumar spoke about nursing at length, what is being done and what needs to be done, commendable efforts. I think, but what you are collected here to talk about the interdisciplinary education here today, and when we look at the interdisciplinary education and when we look at the healthcare delivery specifically, it's a teamwork. We all know that it can't be alone a nurse, it can't be a doctor, it can't be a technician, or even a skilled health professional. It has to be a teamwork. I think there has to be, as Dr. Dilip Kumar mentioned, that a lot of advocacy is required within our ecosystem. That how do we bring this interdisciplinary change into our education, not into the education only, but also into our industry as well, because the implementation will only happen in industry, not only in the education system. So we need to recognize and we need to accept this fact that all of these has to work together at a same level in some sense, because while before entering this conference room, we were having a discussion. The respect a nurse gets today in our country or a doctor gets in our country is very, very variant. Doctor is always top of the ladder. And when we talk of a nurse, probably how much is nurse consulted in any decision is very, very less in our country if we compare to other countries. Probably that needs to increase somewhere, and that needs to increase not only at nurse level, which needs that we need to have a delegation of responsibility starting from top to down or from bottom to up. So that needs to happen. And if we are looking at interdisciplinary system in a country, probably we need to have the regulations, regulatory framework has to change, which will not be an easy system to do, which Dr. Dilip Kumar just mentioned. Getting only a nurse practitioner curriculum, even being at the hem of the affairs, is such a big challenge. So it requires a concentrated effort from industry, because that's where they can lead why this is required, why this is important for us. And probably this is important for our country also, while we have the deficit of skills, we have the deficit of the number of doctors, nurses, allied health, whatever we have. So if we need to overcome all these deficit and the geographical disparity between the skills and the professionals what we have in country, we need to look at some kind of a solution which can bring and optimally give us a solution to optimally utilize our resources, which is our human resources, which is the best, for healthcare. Probably that's the topmost resource what we have. Funding is always an issue, but I think funding anyway is being managed, government manages or public sector manages, but human resource is something, even if you try and have a doctor today, probably takes 5 years or 5.5 years to complete him an MBBS and another 2 to 3 years to complete a PG. So we are looking at, if you start something today, probably you're talking about 8 years down the line or 10 years down the line. If we have to talk about the skill gap today, if you talk about how do we actually bridge this gap, I think the best way to look at is, can we look at task shifting somewhere? If that task shifting can happen, what are the models of education which can come in, which can help this task shifting from one profession to the other, which is nurse practitioner is a case in point here, which is very, very crucial. Similarly, what can be shifted to allied health from nurses, because there are a lot of things which are with nurses, but many of things can be shifted to allied health as well, and similarly to other professions. So what we need to and there are numerous studies. I can quote only one study which I was just looking at through some of the Google search. Niti Aayog actually have done a study where they have done a team learning between at a primary health level. Even at that level, at a pre-HC level, they had seen the improvement of 20% in the patient delivery services at the PHC level. If that can happen at that level, probably what can we see if we look at a tertiary level or a secondary level? So probably there's enough studies and empirical studies which suggest that we should look at collective learning, collective studies. Of course, there's a lot of things to be done. Dr. Smita mentioned about something that we need more teachers, trainers who are actually trained to do that kind of training for interdisciplinary skills. We need different kind of infrastructure maybe, like which is already happening. If you look at what has been just mentioned, that we have a nursing college and medical college at one place today. So probably that's coming together, probably is bringing again together and can happen, which will facilitate the interdisciplinary kind of education which is required. Best required probably for all of us is that the hospitals or the healthcare fraternity, the academics and the regulators all have to come together to see that how we want to take this forward and can benefit our nation, because our population is going to increasing rapidly, and we can't afford to have healthcare for all until unless we have disruptive mechanism within the country to see how we cater to their healthcare needs. So we need to think out of box. We need to think which has not happened everywhere, anywhere in the world probably. Interdisciplinary is one. Maybe there are other areas where we can think of and see what can be brought to so that we can bring healthcare for all. Similarly, say for example, the Ayushman Bharat is one such area which has been bringing healthcare for all, in a sense, if not for all, at least one major stream of citizens have come into the healthcare which were actually not there earlier. They are now accessible to the access to healthcare is there available to these people now. Similarly, once that expanded to everyone, probably we'll have a better position to see that the accessibility increases, the affordability increases, and of course the quality is paramount, and we need to see quality will come only if we have a good quality training, good skills training for all the the healthcare professionals. And what has been referred by Dr. Dilip Kumar, saying that they have brought in a BSc curriculum, which is a competency-based curriculum, which NMC has already done for MBBS now. I think that's where we need to look at. We need to focus more on competencies rather than just a degree. So that's what I'll stop here. Thank you.
Thank you, Ashish. Speaking about allied health sector, the nursing sector, the competency development, I think they need to be plugged in the curricula, and we need to come together, especially universities and organizations, as well as the hospitals and the training centers. We also need to bring the trainers together and have these competencies developed. So recently we had an opportunity to have a workshop with Dr. Purva Makhani. She was from the National Health Systems in the UK, and we thought about having a simulation based learning. So as we many of us doctors, we learned to have clinical skills right directly on the patients. However, I think simulation is something that is going to come in a big way, and really our patients are not guinea pigs or something to be used very freely. for learning purposes, not only for the doctors, but for the nurses and allied health professionals. In fact, we also thought about, understanding whether the healthcare managers, they need to have simulation environment for learning before they even emerge and go into the hospitals for practical experiential learning. So these are the new game changers that need to be plugged in the curriculum. We need to have competency-based education. Of course, some amount of such kind of development of the curricula are happening in the medical curriculum, even the nursing curriculum. That's what Dr. Dilip Kumar did mention. However, there have to be a lot of funds coming in for developing centers of such excellence in simulation-based learning and training of the healthcare professionals. Now, talking about innovations and translational research, we have an expert with us, Dr. Sindhu Mukherjee. He's a managing director of the Wadhwani Innovation Network, and he has been he has also served as a mission director of BIRAT, where he managed initiatives for affordable healthcare in India. So, sir, if you could, just throw some light on how innovations and translational research are so important in, developing the curricula for all kinds of healthcare professionals.
Thank you, Samita, and thank you, Vicky, for the invite today. Excellent discussion. I'll take the discussion to a little bit of different angle, as the session also looks at interdisciplinary education. And innovation plays a very critical role, not only in the delivering of education, but also supporting healthcare solutions, delivering healthcare to the remotest corner of the country, and to build the capabilities within the doctors, the nursing, the paramedical staff. So innovation is a critical role. And to see innovation from the beginning is innovation not only takes place at a one level, and my colleague spoke about, but innovation generally is a teamwork, and that is very critical to bring about innovations. So interdisciplinary research, innovation is very critical to developing curriculum and for the taking solutions to the next level, so that it can impact and we can create affordable, accessible solution to deliver healthcare. And to do that, I think we need to have teams, not only clinical people, but engineering people, basic scientists, paramedics, nursing staff, all sorts of key elements should be built. We call it 360-degree innovation, basically, to see that every element gets addressed and takes place, goes to the next level. So I think interdisciplinary research, which we call it, is a very critical part to take the innovations to the next level. So to say now, the ecosystem of developing these innovations within the government as well as within the philanthropic organization is gaining momentum, and funding is not any more challenge to support innovation at various levels. We literally support innovations, creating incubators in all sets of settings, like medical schools, engineering schools, joint incubators between medical schools, engineering schools, nursing schools, pharmacy schools, so that innovation develops as a team. And once the innovation is developed, it can be, the innovation should not stop at the lab. It should not stop at the bench, but it should reach the bedside. So for that, you need all critical elements, and that is the reason we need a very strong interdisciplinary approach. So that one critical element needs to be built into curriculum of all the medical faculty, medical courses, paramedical courses, nursing courses, because everybody needs to understand innovation and solutions to solve critical issues. And we saw that in COVID times as well, starting innovations starting from basic ventilators, which were done by a lot of startups, the solutions for PPE kits, everything came out, and we literally initially we started importing, but then we became self-sufficient, and the vaccine story was an excellent example, and I was privileged to lead the mission COVID Suraksha. So I think vaccine, not only in India we supported everybody for our vaccine, but we almost exported to 80 countries around the world under the Vaccine Maitri program. So I think that is one thing. Second thing which we need to literally promote within the medical schools is that a culture of startups as well. Innovation will come out only if we look at the end point of the solution. And for that, we literally have to have a enterprise-based innovation. Innovation which comes out from a system needs to be literally spinned out into enterprise. And for that, the culture of startup needs to be built up into the curriculum, so that, because doctors are busy, they will have to treat the patient. But I think a culture of startups, by building a team of enterprise around them, which will be, and we are promoting it, the government is promoting very strongly the Startup India program and things like that. So we literally need to support that, but the message needs to go out to all the clinical community, that sort of situation is available. We have facilities, we have incubators built up now. So I think that message needs to go out, and literally that should support. Funding is not a challenge anymore, but we need people who literally would take up these challenges, innovative challenges, to find out solutions which are affordable, accessible, and literally reaches the bedside as well. Thank you.
Dr. Mukherjee, you did mention about the startups. Of course, our Prime Minister Modi ji, he has spoken about Make in India, and there are a lot of opportunities, especially for doctors, nurses, even allied health professionals, healthcare management, even students. So we had a very recent experience at SIBM. It's a purely management institute. So there we had the startup, organizations coming in, and they bid for about, last year it was 5.6 crore of bidding. But this time, to our surprise, it was 21 crore of bidding just for students who, developed an idea. And this Shark Tank, culture is really coming within the walls of the institutes where we are nurturing, healthcare education. So I believe the innovation is something that it can happen at grassroots levels. Even a simple, Anganwadi worker, when they are going out and, checking out hemoglobin by using their mobiles, of the, especially the pregnant mothers during ANC. I mean, this is going to have a lot of reach in accessibility and availability of the healthcare workers at remote areas. So this is a wonderful time where startups how are innovations happening and what is really happening. There is an idea in everyone's mind, but what to do with that idea, the students are not really aware. So I think fora like us and FICCI, they are really promoting even startups. There was a discussion regarding various innovative ideas for such kind of privileges that the students and of course innovators in whoever are having healthcare as a predominant area of emerging in economies is something that can be done.
And
Even
Samita, just to add, the things
Yes.
have been simplified now. I think we have provisions within the incubators how to write grants, because students or the clinical faculty doesn't have time to write grants. So we have facilities now incorporated how to write grant, where to go for funds, how to build up. We have incubators to support them, mentors to provide them. Things have been very much simplified now. So this is the very opportune time, and it's the right time to build in a good curriculum of innovation within the education system, to see in clinical medical education system, to see how they can really support innovation for affordable healthcare delivery.
Yeah, and just to take this ahead, I mean, the doctors have so many ideas, but they really don't know what to do with the ideas. So we have the engineers, and if there are institutes where there is a synergy between the engineering students as well as the medical students, or even the doctors and the faculty of engineering, such kind of startups or even development of technology can happen in a very, very big way. With AI coming in and machine learning and deep diving happening in various areas of healthcare, I'm sure Dr. Mahajan, I mean, he can vouch for the explosion of such kind of AI that is reaching the CT scan and imaging sciences in a very, very big way. And of course, telemedicine opportunities are there. So we would now talk about, we just now in the last session we had, a wonderful session on trust issues amongst doctors and patients. Then to take this ahead, I mean, we also need to understand that communication is such an important aspect of, coming together, not only for understanding the patient's but to understand the thinking and collaborative work, especially in the clinical decisions with doctors and nurses and the allied health professionals, because most of them are working together. Even healthcare managers, they are working on ground in various hospitals. Some of the CEOs are not from a healthcare profession background. So we would like our next speaker, Mr. Nilesh Agarwal. He is the son of a renowned Dr. Agarwal, who has really worked so much during the COVID times, and he has a lot to speak about. The communication strategies, as well as the digitization that they have used in developing various fora for communication with the audience, for healthcare professionals, and of course for directly to the patients. All yours. Yes, yes, no issues. He has a presentation, so I think we'll all be a little knowledgeable about the role of communication in interdisciplinary education. So just make it brief, but.
Yeah, I'll make it very brief. I'll skip through a lot of things because I think everyone has covered those already. So thanks for having me. Good evening, everyone. So just talking here about why healthcare communication matters. As ma'am rightly said, it's very important for doctors to be able to communicate to patients, given the amount of violence that is happening against the healthcare professionals, etc. How to break news to patients, how to communicate the disease to patients, etc. It's very important to focus on patient outcomes, patient understanding, building trust between all healthcare practitioners, all allied healthcare workers, caregivers, etc., between patients. Also making sure that the public is literate, and we are focusing on public health literacy and using technology to do the same. So, which is why there is a need for healthcare campaigns and government involvement. So, public health campaigns on a large scale, the government being part of it, national campaigns which have been successful, such as the vaccination campaigns that was mentioned earlier, our learnings from COVID, and stuff like tobacco-free initiatives, etc., have all been public health strategies that have gone on. To make these effective, we need to use all kinds of media to communicate well, using television, radio, social media platforms now, influencers, etc., to reach a large audience. We want to focus on doing this through regional languages as well, to reach all the masses, whether it's tier 2, tier 3. Working with health workers to engage with local populations in culturally appropriate ways, given that India is such a diverse nation with so many cultural and religious beliefs, how to break news to them according to that, etc., is very important. And this is not something that any doctor, any nurse, etc., is trained in. So it's very important for everyone to come together and the use of interdisciplinary education to train in all of that. As I mentioned, digital health, then starting at schools and workplace programs, collaborations with NGOs, etc. As I mentioned, language barriers are extremely important. A lot of people want to learn in their regional languages. Predominantly, the education in India has been through the medium of English, but we have seen a lot of companies like ourselves also doing a lot of training programs in local languages, and also encouraging doctors to speak to their patients in their local language and explaining the disease, etc., in local languages. So just the sense of interdisciplinary collaboration in healthcare. So I think all of this has already been talked about, so I'm going to skip it. The patient today is going through Dr. Google. They're coming with, they think they know more than you, more than doctors, more than nurses, more than paramedics, because of what Google says. So we have to be very, very careful in addressing this. Encouraging patients to only trust verified sources and not only believe what they read online, to have trust in the doctor. So it's very important for effective communication, for that doctor-patient trust or the nurse-patient trust, etc., to stay intact. Right? So which is why we promote trusted sources. All the healthcare professionals should be very active on social media. They should be communicating effectively, whether it's through Twitter, whether it's through Facebook, whether it's through Instagram. One small thing I also want to touch upon is continuing professional development, which was earlier known as CME, continuing medical education. This is also a very, very important role for all doctors and all nurses and all paramedics and allied healthcare workers to continually learn, because medicine is always changing. And to do effective CPD, communication is extremely important. So we need very, very eloquent speakers. We need a format which is easy to understand, which is easy to understand, to get. A lot of case study based based curriculum, etc., so that they can actually treat patients well and also focus on communication in these models. So historically, CPD has only been on very, very hardcore scientific topics, but we are also working now on creating communication skills and different topics, empathy, compassion, etc., which we need to impart to doctors. These are done through workshops, webinars, e-learning, various platforms. We run a platform where we have done over 1,500 webinars, out of which a lot of them are on soft skills, etc. So we have this platform where we do all of that. A lot of the medical societies, a lot of the bodies, etc., the NGOs are also working on a lot of these programs. The other thing that's very important in terms of learning and communication is using medical writing to be able to communicate effectively the latest research that is happening, so that the doctors and the other healthcare professionals can make the right choices. A lot of patient education to be put in doctors' chambers along with nurses, etc., so that they can effectively communicate and explain what is going on, along with visuals, along with a tab, along with diagrams, etc. Using the media, so using doctors to be spokespersons in the media, etc., so to spread the right information, and etc. I just wanted to touch upon some things that we can learn from our late father. So Dr. Agarwal always said that the doctor's job is not only to heal but to educate and empower. So doing that throughout his life, etc., he was doing a lot of public health work, and I think he was a very, very effective communicator, which is why I'm bringing him up here, so that we can actually learn from all the communications work that he did. During COVID, I think we had 100 million unique views, so 10% of the population were seeing his videos, and that he managed because of very, very effective, simple communication in English, Hindi, getting guests who spoke in regional languages as well, and to be able to manage to connect to such a large audience. I think that's a very, very good communicator. So we also trained 1,000 COVID educators, and these were lay people without a healthcare background, who were then responsible for thousands of patients themselves. So there was a crash course done for these people, and revision done every week, where simple cases of COVID were treated by them because the burden was so high. We also trained over 500 resident welfare associations for their communities. I think the RWA model is extremely important because they are responsible for their entire community. So pan-India, if you can look at training all the RWAs in healthcare, that reduces the burden. As I mentioned, we did over 1,000 webinars for doctors, nurses, allied health professionals, etc. And again, the key for being so viral was to allay the fears, to say it's not that big a deal, to tell them to calm down, which is very, very important when somebody is scared, right? So I think a lot of these we can implement in future programs for future pandemics, etc. As his last words were, the show must go on. We've kind of continued everything that he was doing. And we have Dr. Sanjay Kalra, who's led most of these programs, and we continue to do all of these works. Some other works that we have done and which we feel can be done across, etc., is rural area training. So tier 2, tier 3 doctors need to be trained in rural languages, obviously in English as well, but rural languages to be able to communicate to patients. In nursing, it's very, very important. We ourselves have worked with a lot of nurses to train them, but there's a lot of opportunity to Pruna's server saying that, we need to help increase the salary also with better training. We've also done a lot of work with the Live Love Love Foundation, through which we focus on mental health, and mental health is one area where interdisciplinary education is extremely important, because from a caregiver to an ASHA worker to a nurse to a doctor, everyone needs to be compassionate about medical health, because that person might not speak to the doctor. The patient might speak to the receptionist of the doctor about it, because they might not be comfortable inside. The receptionist should also know how to communicate with the patient to be able to see if they have any mental health issues or any other issues, which they can probably be able to gauge, right? Another thing is community medicine. We've been doing something called the Perfect Health Mela since '93, where we encourage all pathies to come together. So it's very important also for there's a lot of debate about modern medicine, Ayurveda, etc. A lot of people fighting together, but we believe in holistic and integrative medicine, and that's why we hold these kind of fairs where all kinds of doctors, patients, etc. They all come together, and we promote prosperity amongst the industry. Another very important thing is training educators. So I talked about COVID educators, but very important these days to train diabetes educators, dietitians, etc. Because your gut is your new brain. So it's very important to see what you eat. So a good diet really supplements what a doctor is prescribing, what a nurse is suggesting, etc. So there's a lot of scope for that as well. So as I said, clear, honest communication, public engagement, empathy and compassion, focus and prevention. Yeah, and that's just a conclusion. Thank you.
Thank you so much for telling us so much about how communication and soft skills are so important in intercollaborative understanding and of course learning. In fact, yesterday Mr. Kapil Dev, he mentioned about why doctors are always not smiling. So you should enjoy life and be happy. I think this was a very subtle but very important message that he gave us. That we need to be happy ourselves to spread happiness amongst our community, not only doctors, because we are working alongside with nurses who are spending more than 8 hours per day with patients who are at the level of the nursing counter. You'll be surprised that they really face such a lot of stress, because the patients are talking to them, the doctors are yelling at them. The nurses, the supervisor nurse is also talking to them in not in a very nice language. So I think communication and that kind of language development amongst our own fraternity is extremely important. And then there is a discussion with the patients. If the communication strategies with the patients is really looked at in a very proper manner, and if the trainings are given, even simulation-based training for the doctors and nurses, and in fact the entire healthcare community, we will be able to face patients in a better way, and there will be then the violence of healthcare, against the doctors will be mitigated to some extent. In fact, some hospitals, especially the tertiary care hospital, they have trained their doctors and nurses, to have an interaction with the patients on a daily basis to understand what is the line of treatment that the patients are getting, and what are the medications that they are receiving, and also why the tests are being done. Because again, then this mitigates the issues of trust development. If the patients are really explained once they are admitted in the hospitals of why every step of medical care is given to them, and if it is affordable or not, it is the decision is left to the patients. So at that point of time, it's very important to be very, very open and very clear with the patient interaction, and all these problems really would be in some way mitigated. And Dr. Dilip Kumar sir, we just wanted to know, like there are various institutes where they are developing language skills to the nurses, and because of this, and they are training them to go to offshore countries for getting better pay packages. So how are we really looking at the brain drain in nursing professionals?
I think the issue of brain drain, I said that if the working conditions are improved in the institutions, at least when I was the nursing advisor, when we went to the pay commission, one of the WHO principle was given to the countries were how to attract, how to retain. That is the principle gave. That principle we put it in a recommendation in the pay commission, and we were able to get a pay package for the nurses working in a government sector. At least the central government nurses working, I think the first month pay packet is something like 75,000. I think in other countries, the reverse. The private sector pays more, the government sector pays less. But in India, the government sector is paying very high salary, whereas the private sector is not paying very high salary. That is so therefore, I think now the government of India has taken a policy decision that that since we have at least know the capacity of the nursing education institutions arrive, why can't they allow them to go? Officially, I think the ministry is encouraging for the nurses to go abroad, and we at least know the first, the Japan is looking to India, and now the many other UK and Germany are looking good pay package to the nurses, and the issue comes about the language. So in that perspective, at least Indian Nursing Council has taken a policy decision that we have allowed them a regulation to all the institutions. We don't have an objection that they can engage any foreign language in the basic nursing education itself. So that gives a scope for the nursing education institution in whichever like northeastern states. We started at least through the National Skill Development Corporation (NSDC), in College of Nursing in Guwahati, we started a Japanese language. So that made us to come out as a policy. Now we have allowed all the educational institutions in a 4 years period. I think they can have 1 hour or 2 hours depending upon the different, because see, even for a 6th and 7th, we are promoting a foreign language in the general education. Why can't we in the professional education having a foreign language is an asset? So therefore we have promoted as a policy. But now we have to see how like National Skill Development Corporation is also working with many of the countries, providing good working conditions, because there are, in Middle East, the Middle East has taken a policy decision that they will only take the degree nurses. They have said that the Middle East is not allowing the diploma nurses. So many of our 25,000 nurses working in Middle East, so they were having a problem, and we have to tell the Middle East, the policy makers in India, a diploma in general nursing is a minimum qualification to be a staff nurse. So they should be treated. So at least now there is some, so therefore even we have taken a policy decision that the upgradation of schools into colleges of nursing. Like for example, Safdarjung and Lady Hardinge, and these are 3 central government hospitals where I was the nursing advisor at that time. A country like India, still these hospitals are having a diploma. That's why I think now these 3 institutions, we were able to give 8 crores. See, the problem is the investment. Money is not coming. So Government of India at that time, we were able to give the money. All the 3 central government institutions, no more diploma. It is a BSc nursing college. So now when we went to the ministry as the Indian regulator, why can't we make a policy? But at least they have put a hold that in abeyance. But at least they have given an approval that why can't you, if anybody wants to do a voluntarily, if they want to upgrade the school into college, that policy has been approved now. I think Chhattisgarh and some of the government institutions like Orissa government has come forward. Even the government nursing schools, they are upgrading into College of Nursing. That's a good trend. But definitely the brain drain is going to be an issue. But for that, we have to address in the various issues. For that, I think at least in principle, whatever the Supreme Court guidelines, some instructions are there, that at least to start with, if you address those, then I think that becomes a benchmark to achieve the other things.
So I've just received a message from Major General Dr. Atul Kotwal, sir, that he is, at Nirman Bhavan. He's stuck there, and he's having meetings with the Secretary of the Health and Family Welfare. So he'll be a little late. So in the meantime, I think I've been given to understand that I need to wrap up the sessions as soon as possible. So last but not the least, I would like recommendations from each of the panelists regarding how we could improve the healthcare proficiencies. So we'll just please make it very brief and short, Mr. Ashish.
I think only one, that we should focus on competency-based, training and skills rather than anything else. Thank you.
Build in an innovation curriculum into the program, interdisciplinary innovation curriculum, so that we can bring out innovation which can help us to deliver affordable healthcare.
I think simulation-based and experiential learning should be a part of the curriculum, and they should be centers of excellence in creating, the trainers as well as training the students in various healthcare institutes, may it be public health or may it be healthcare management, even the mental health, because this is again coming in a big way, as well as the nursing and the allied health professions.
My recommendation is going to be at least, if we implement the WHO strategic direction of nursing and midwifery 21-25, those resolutions, if implemented, some resolutions pertain to the national level, some resolutions are to be implemented with the state governments. The implementation is going to make an impact for the strengthening of the nursing education. Not only strengthening, but many resolutions are there which are focusing on the specialization, nurse practitioner program, impact and outcome for the patients, or those resolutions are there that needs to be implemented.
Sorry. I think I agree with everything everyone has said. I was going to say one of those. But implementing everything that everyone said, along with good communication skills and aptitude, I think is very, very important, because some person might grasp something earlier. Plus a person's, if it's a doctor, what specialty might one person be suited for more, etc. I think it's very important to differentiate that.
I'm sure Major General Atul Kotwal ji would have spoken about, public health advocacy, and we are getting such a good fora at the FICCI level, and a wonderful platform where we could really reach out to all the healthcare professions and talk about not only the medical education, but other healthcare professionals, upkeep, and making the healthcare professions cohesive, and we need to reimagine the entire healthcare system. So I just want to end on the note. Of course, I would like to thank all the FICCI members for giving us an opportunity to speak to all of you. And the last but not the least, there was during quite some years back, when our erstwhile Prime Minister Indira Ji, she spoke to squadron leader Rakesh Sharma, and she asked, what do you see from wherever you are? How does India look? So he just mentioned that Sare Jahan se Acha. So I think we are very hopeful of a better healthcare system, and with synergies coming from all of you, and of course FICCI and various institutes and healthcare organizations that have participated. I'm sure we are going to have a wonderful decade ahead. Thank you so much for being a patient audience.
Thank you so much, Dr. Jadhav. Thank you to all the panelists for a wonderful session. And now I request Dr. Harsh Mahajan, Chair of FICCI Health Services Committee, to kindly conclude the conference for us. A big thank you to everyone who joined us today. Thank you.
Thank you, Shilpa. Thank you, Sarita, and your entire team. I think you did a brilliant job. We've had 2 days of scintillating discussions, interactions. I think some of the best of the healthcare industry, doctors, teachers, nursing people, educators, all of them were here. There was a lot of passion in the way people spoke, a lot of academic content, a lot of practical wisdom, a lot of experience. I think for all of us, it was great learning. So thank you all very much. And also the awards night, I think, was enlivened by the presence of Mr. Kapil Dev, who spoke practically. He always speaks from the heart, and he enjoyed being there. He rang me up even in the morning today to say how grateful he was that he was called to such a function. So we look forward to learning from this exercise and also hoping that there would be some actionable change on the ground that would happen through the deliberations that have taken place over these 2 days. Most of what has been discussed, I think, would get available on the FICCI website. The knowledge papers, I think, have already been uploaded and would be available, and we will always be there to reply to any queries. What I have requested, seeing how successful this conference has been, more than 500 people actually physically attended, and the fact that there are so many here at this point of time speaks volumes for the interest that was generated by the quality of the speakers as well as the quality of those who attended. I would request that the dates for the next FICCI conference should be decided quickly, as should be the venue, so that people can plan this for the future. Thank you all very much. And is tea served? It is. Thank you. Let's have tea.